Hypertension can be considered as persistent elevation of the blood pressure. Of course, we all have a blood pressure that varies from time to time, but persistent elevation of blood pressure is associated with a number of longer-term complications, stroke, heart attack, arrhythmias, particularly atrial fibrillation. And the difficulty with the diagnosis of hypertension is that it is often silent. It's something of a myth to consider that hypertension will always be associated with headaches or other symptoms. In the vast majority of patients, hypertension is totally silent and can only be detected by regular measurement of blood pressure. So I always advocate that patients, particularly those at high risk, such as those having diabetes or other cardiac risk factors, should be vigilant with recording their blood pressure, ideally at home, since this gives us the clearest indication of whether the blood pressure is persistently elevated. Although we do have other tools for measuring blood pressure, including ambulatory measurements. To be honest, the clinic readings are probably the least helpful because many patients suffer with white coat hypertension, and the readings will be artificially elevated when they are sitting in front of a doctor or a nurse. So in the vast majority of patients with high blood pressure, there are no specific symptoms. Of course, chest pain, breathlessness, headaches can often be an indicator that the blood pressure is elevated, but as many patients will have no symptoms at all. And for this reason, opportunistic measurement of blood pressure, whether it be at home or in the doctor's surgery, is sensible for any adult. It's very important when assessing a patient with hypertension to understand their overall cardiovascular risk, because hypertension on its own may not necessarily increase the patient's risk significantly. But if the patient also has an abnormal cholesterol or is diabetic or is a smoker, then of course the risk becomes significantly increased. So the first step is to assess the overall cardiovascular risk. With regards to blood pressure, there may be changes on an ECG, but more often we need to perform an ultrasound of the heart, known as an echocardiogram, to see if there are any structural changes in the heart that reflect persistent elevation of the blood pressure and an increased workload on the heart. The most common of these would be thickening of the heart muscle, otherwise known as left ventricular hypertrophy. We normally consider the patient's lifestyle as the first port of call when treating hypertension. There is no doubt that improvement in diet, particularly a reduction in salt, caffeine or alcohol, can result in significant improvements in blood pressure. There is also a lot of evidence that exercise can improve blood pressure. Even 5 minutes a day can be helpful, but we would ideally advocate 30 minutes on a regular basis. If despite these changes, or if there are already additional risk factors, or if there are evidence of changes in the heart structure and function, then we would of course start to consider medication. And there are a number of alternatives when treating blood pressure with medication, but the principle is we normally try and find a medication that is well tolerated and will gradually up-titrate the medication to achieve a target blood pressure. Without doubt, weight reduction is extremely important to manage blood pressure. The second most important is reduction in salt intake. And this can be extremely difficult given the amount of processed food that we generally consume in our diets. But patients who have been able to achieve a reduction in salt intake often see very significant improvements in blood pressure. Regular exercise, even a minimum of 5 minutes a day, just climbing the stairs or walking to work rather than taking the bus, may be helpful. Caffeine and alcohol are other factors which will elevate the blood pressure. Distress is a contentious area, but undoubtedly people in a very stressful work environment or with very stressful home situations might find that their blood pressure is elevated.